Hi, how's it going? I'm
Hi,
Tom.
Tom, lovely to meet you. Just grab a seat.
Sure.
Have you had a read of the stem?
Yeah.
Okay, so first question, Tom. Consider the ethical problems that Dr. Smith's behaviour might pose. What are they?
Okay, so I think there are a few different people to look at in this scenario. So there's the patients of Dr. Smith, Dr. Smith himself, what are his sort of motives, and I guess like general public and their opinions of homeopathic medicines as well. So I guess like the biggest ethical problem I see is trust. The problem with what Dr. Smith is doing is that he's like with knowledge giving his patients sort of homeopathic medicines, or I guess in his eyes placebos, but not necessarily eliciting that kind of information to patients. And I guess the foundation of any good sort of interaction with a doctor in my eyes, it has to be patient-centered, but also there has to be a trust between the physician and the patient. And by ignoring sort of non-specific symptoms and just sort of, it's just like another headache or a migraine or whatever it is, and giving homeopathic medicine, my real concern is sort of like the more traditional medical ethics principles, as well as like non-maleficence, so avoiding harm. And he's sort of contraindicating that because non-specific symptoms, although they're non-specific, they can indicate sort of more nasty things. And you want your doctor to take all the concerns that you come with seriously. Like headaches and fevers and things, they can be cancers, not always obviously, but you want your doctor to take things seriously. And by sort of blanketly, to take this pill, there's no necessarily evidence-based practice towards it, he's obviously putting his patients in harm's way. In terms of the patient's view, so I think, I can't remember the name, sorry,
Smith, Mr. Smith?
No, the patient, I can't remember the name of the patient, but that's okay.
Miss Chan.
Miss Chan, okay, so whilst Miss Chan might be getting some relief from the medication, I guess my concern is her understanding of what she's taking, and is she falsely believing that it is some sort of therapeutic, and if it isn't a therapeutic, it's fine that she can take it, but the doctor really has a duty to be honest with her and to tell her that by taking this medication, there's no necessarily proven effects, but if you get an effect out of it, that's fine. And in that regard, the ethics for me regarding homeopathic medicines is mostly avoiding harm. I don't have a problem with any people using it, especially if they're shown to not cause harm. And even in medicine at large, I think that's the way most practice is done. There are certain things that are done that haven't necessarily been traditionally proven to work, but we know they don't cause harm. Just putting lemon in your tea, it's not going to cause you any harm, and if you get relief from it, then you get relief from it, and that's fine. But I think the key is involving the patient and actually having that trust and sort of back and forth relationship in the sort of situation. And in terms of the public at large as well, I think homeopathic medicines are often seen with a sort of, it kind of depends on the community, I really guess, but I think homeopathic medicines are seen as like separate to medicine, and I think that's something that doctors, especially modern doctors, should make an effort to sort of dissolve. You really want to engage all people, no matter what they want to do. If they want to use homeopathic medicines, that's fine, but still want to engage them in traditional medical practice, because if something does go wrong, then the physicians are there to sort of intervene with high-level medical care if required. So yeah.
Okay. Would there be any other further ethical concerns?
No, not that I can think of.
Okay, that's no problem. So what are your views on complementary medicine and its role in healthcare?
So a lot of what I said already is sort of, I think that there's definitely a role for complementary medicines. And whilst the placebo effect is a placebo, there's still merit to any treatment. If the patient gets good benefit out of it and they feel good using the treatment, then I don't see any problem with it really. I think my biggest concern is when it's used in place of traditional medicine, sort of as an alternative rather than engaged with it as part of sort of just a holistic view of medicine. What else? I think there's also concerns of being manipulated, so complementary medicines aren't necessarily held to the same rigour as sort of pharmaceutical companies are. Don't have to go through like the FDA and the TGA and all those sort of guidelines and therapeutic approval process. And again, it just comes back to that non-maleficence, like I don't want to cause harm to the patient. That comes before all others, I think. And you also want to give patients' choices. That's part of their autonomy. So if there are complementary medicines available, I think it's the job of the doctor to explain those to patients, give them the choice, make them the centre of the care. But I guess, all medicine at some level is evidence-based. And my concern as a doctor is that complementary medicines won't come before evidence-based proven medicines that have efficacy. I think they still have to come first as a doctor, but that doesn't mean you don't engage complementary medicines at all. I think it's a bit foolish. Okay.
In this scenario, if a patient opts for a homeopathic treatment rather than, say, a traditional standard medical treatment, how would you approach this situation, and what strategies would you use to change their mind?
Sure. Okay. So I think there are a few things. So you want to really understand first that patient, where they're coming from and why they've made the decision. For example, they might have made their decision from previous bad experiences with traditional medicine, or they read something on the internet. It's pretty common these days, sort of Dr. Google. And there's nothing wrong with patients being sort of well educated and understanding what they're doing with their bodies. Because the problem is, if you don't ask about it, they're never going to give you that information. You don't want to cast any negative dispersions on their choice, because obviously that's the worst thing to do. If you tell someone not to do something, the only thing they're going to want to do is do it. So really speaking to the person, getting an understanding of who they are, then really explaining your treatment. So let's say we're trying to give them, an injection of some kind, like a vaccination. That's just an example. You really want to explain all the sort of what it is, how it works, all the positives, the cons, possible adverse effects, contraindications. And then once you've done all of that, you've given the information to the patient, you understand where they come from, you address the homeopathic medicine, say, look, maybe look it up on some sort of software like Up to Date, get the evidence on it, discuss that option, and then just present it to the patient and let them make a decision. And you can't be angry at them for that decision.
I think time's up.
Yeah. Okay.
All right. Thank you.
Thanks.